But up first tonight, we examine the issue of children's health. In recent years, the numbers of uninsured Americans has grown. As many as 11 million are children. A new government-funded program for children is enrolling many of the previously uninsured and having great success in North Carolina. Dr. Tom Linden introduces us to 3 North Carolina families who know the heartaches of living without health insurance.
9-year-old Corey Debnam of Raleigh was born 11 weeks premature, weighing just 2 pounds, 2 ounces, and leaving him with impaired vision and other medical problems. At times, Corey's mother hasn't had money to pay for her son's medical needs.
From birth, Corey had Medicaid. Corey and myself, we both had Medicaid. I was a single mom, and that was the only thing available to me. I went back to school. I got a high school diploma. Then I went to college and got a degree. And when I got a better paying job, the Medicaid was turned off, and we didn't have any coverage.
Oh, beautiful. Very good. Excellent.
Sonia Debnam now works as an office administrator, earning less than $20,000 a year. She can't afford private insurance for Corey, which could help pay for the $1,200 of allergy medications he must take every year, plus $500 for special eyeglasses. Then there are unanticipated expenses, a worry for all parents whose kids are uninsured.
He would have broke an arm, where if he would have had to go in the hospital, it would have been too much for us.
In Johnston County, Dawn Armstrong, mother of 17-year-old Jennifer and 12-year-old Anthony, couldn't agree more. Though she works 2 jobs, they don't provide health insurance for her children. She says she was constantly worried until her children got insurance.
I was always scared for them to roughhouse and play around rough for fear they would get hurt.
Dawn says just seeing a doctor for routine childhood illnesses meant tough choices for her and her kids.
I would either have to take money that was for a bill or for groceries, or I would have to borrow money. I have had to borrow money to take them to the doctor. And it's difficult as a parent knowing, you want to protect your children. And it's kind of a small blow to know, hey, I can't even pay for a doctor bill.
Fortunately for the Armstrongs and Debnams, protection has come in the form of NC Health Choice, North Carolina's Children's Health Insurance Program, or CHIP. The government-funded insurance covers 69,000 children in North Carolina. Public health experts say the $110 million spent on CHIP in North Carolina each year is worth it. Despite the success of NC Health Choice, many children are falling through the cracks. That's because their families earn too much to qualify for assistance, but not enough to pay for health insurance. Adam Parks is from one such family.
Sounds like you're pretty busy there.
Adam suffers from extreme sensitivity to touch. He needs therapy to overcome what doctors call a sensory integration problem. Adam's mother, Lynn Parks, and her husband, a satellite dish contractor from Durham, earn $6,000 a year too much to qualify for NC Health Choice or any other government insurance. They pay medical bills out of pocket, but can't afford to pay for sensory therapy.
If we had the insurance coverage and could get the therapy, Adam might be a little bit better off. The question of the unknown there.
Because we know the therapy's out there for these kids, and we know that there's some things that would benefit them, and yet the only thing that's keeping them from getting it is just the fact that they don't have insurance or financial means to get that.
That's probably okay.
Child advocate Tom Vitalione proposes a solution which has the support of many healthcare experts.
I'm in that group that really believes it needs to be a universal health insurance system. I have great confidence in the studies that have been done that shows that it is a cost-effective system. In fact, there are some studies that say there's enough money in the system now, you just have to rearrange how it's done.
We're the richest country in the world, and when we look at countries who are not as wealthy as we are and find that they do have national health insurance, and then we're faced with a problem of 44 million people being uninsured, it's absurd.
I got you.
Until some solution is found, Uninsured mother Lynn Park says her family will continue to budget for Adam's doctor visits and medications. And if Adam ever needs critical care, she says she'll take him to the emergency room and worry about costs later. As for the therapy she can't afford,
Adam's made so much progress with the help he gets at school, but there'll always be a part of me that wonders if we could get the sensory integration therapy, what more could Adam be? Not that I'm not happy with what Adam is, but you know, you wonder, is there more there that could come out? And I think about that a lot.
Mouse Pokemon, just like Pikachu.
in Johnston County, Anthony Armstrong continues to struggle with attention deficit disorder. Having health insurance and regular medical care has helped him make tremendous progress. Family members, teachers, and especially Anthony himself say they can see a difference. His advice to government officials and others debating the future of subsidized health care?
Don't stop. Just keep giving children and adults health insurance.
State health officials estimate that as many as 16,000 more children may be eligible for NC Health Choice until the federal government shifts some of the existing funds from states which haven't fully used them, like California and Texas, to North Carolina, or allocates new money. No new children will enlist in the program. And even with an infusion of new federal funds, families are eligible only if they earn less than twice the federal poverty level.